We welcome you to our free webinar, Pursuing Studies on Brain-Behavior Relationships, a guide for undergraduates interested in clinical neuropsychology. My name is Octavio Santos. I'm a predoctoral intern in the neuropsychology track at the South Texas Veterans Healthcare System in San Antonio, Texas, and I'm the liaison officer for the Association of Neuropsychology Students in Training, ANST. This webinar is aimed at providing guidance for undergraduate students interested in pursuing education and training in clinical neuropsychology, and is done in collaboration with the Association for Doctoral Education in Clinical Neuropsychology, ADECN, and the American Psychological Association of Graduate Students Committee for the Advancement of Racial and Ethnic Diversity, APAGS-CARED. For this webinar, the speakers will present key information about things to consider when looking for graduate programs, and will also provide recommendations and resources. Attendees can submit questions anytime throughout the webinar by using the text box on the right side of your screen. These questions will be answered right after Dr. Schultheis's presentation, and then at the end during another Q&A session. I'm very pleased to introduce Dr. Maria Schultheis. Dr. Schultheis is a professor and head of the Department of Psychology at Drexel University. Her clinical and research experience have been focused on the rehabilitation of cognitively impaired populations, including traumatic brain injury, stroke, and multiple sclerosis. She has specialized in the application of technologies to address clinical needs, and her work cuts across the fields of neuropsychology, rehabilitation medicine, computer science, and transportation. A main focus of her research is studying the demands and driving following neurological compromise, including the development of new driving assessment protocols for individuals with disabilities. Her research has been consistently funded by several organizations, such as the National Institutes of Health, the National Institute on Disability and Rehabilitation Research, and the National Multiple Sclerosis Society. She's the president of the Association of Doctoral Education in Clinical Neuropsychology and associate editor of the journal Rehabilitation Psychology, and serves on the editorial board of the Clinical Neuropsychologist and Neuropsychology.
Okay. So thank you, Octavio and Ann and the group for putting together what I hope will be an informative presentation. So I thought that I might start first with a little bit of an overview and then go into specifics about things to think about during your undergrad training that would make you a competitive candidate for graduate training in neuropsychology. So one of the first things that I want to do is to provide some clarification about what neuropsychology is. By definition, neuropsychology is a branch of psychology that specifically focuses on the relationship between behavior, emotion, and cognition in relationship to brain functions. Put briefly, neuropsychology focuses on brain behavior relationships. Now, that is the broader definition, but it's important to highlight that you can then take this knowledge and apply it in a variety of ways. The way that we'll be talking about it today is in the area of clinical neuropsychology. So this is in particular for those individuals that are interested in applying neuropsychological knowledge to the assessment, the management, and the treatment of individuals who have suffered some kind of illness or injury related to the brain, commonly neurological or psychiatric injuries or diagnosis. So this is the clinical application of neuropsychological data, clinical neuropsychology, and it's what we'll be focusing on. But to be clear, a neuropsychologist can also be a cognitive neuropsychologist, which might be an individual that doesn't apply the knowledge to clinical populations, but rather applies the knowledge to understanding the relationships and the functioning between these brain behavior connections. There's other new and growing areas such as cognitive neuropsychiatry that overlap with neuropsychology. And so I would encourage students to really have clarity as to what aspects of neuropsychology they are interested in, as they have implications for which type of programs you might apply. So most of the programs that we're referring to today will be in relationship to clinical neuropsychology. Next. So a lot of times, people ask me when I tell them I'm a neuropsychologist, they often say neurologist, psychologist, and really the definition in many ways is a little bit of both. In the simplest way, neuropsychology refers to how we think about human behaviors. That's the psychological purpose, because we are studying human behaviors. The neurological component has to do with the brain, the anatomy, and the brain functioning aspects. A common shortcut is that we refer to ourselves as brain experts. There's a difference in that we are not your typical psychologist, because often neuropsychologists take a very biophysiological perspective to things. And this may different than kind of the traditional definition of psychologists that often focus on therapy, treatment, and different types of intervention approaches. So the other misconception is that a lot of time neuropsychologists are only viewed in relationship to the tests that we can use to evaluate brain functioning. And I emphasize this as a misconception because the field has really expanded, and we do more than assessment. We contribute to intervention. We contribute to treatments. Neuropsychologists are involved in all aspects of clinical care nowadays. So it's important to kind of separate who the neuropsychologist is than kind of the more commonly known neuropsychological tests that we use. Next. So neuropsychology, if you go on to be a neuropsychologist, it really can create multiple opportunities, different type of opportunities. And it's something that I encourage students to think about when they're considering graduate training. There's a variety of areas or roles that you can play as a neuropsychologist. You can do strictly clinical work. You can be in academia and teach, be a professor. Many neuropsychologists do the majority of the work focused on research. Many people are in industry, perhaps working for pharmaceutical companies. The majority of the colleagues that I know in this field, and one of the advantages of this degree, is that you can have a job that includes multiple pieces of this. You might have some clinical responsibilities along with some research responsibilities, or you might have a balance between teaching and research. So there's an opportunity to play different roles and contribute to different areas with this degree. There's also a variety of populations that you can work with. So you can work with neurological populations, psychiatric populations. A lot of my work is personally in the field of rehabilitation medicine. Neuropsychologists can work with adults. We also have the subspecialization of pediatric neuropsychology, which focuses on the developing brain. And you can work with individuals in clinical populations or in non-clinical populations. Many neuropsychological studies are based on what we would call healthy controls that are used to define these brain behavior relationships. And then there are animal studies, basic science animal studies that can help contribute to our understanding of these links between brain and behavior. And of course, all of these possibilities lend themselves to multiple settings for work. Many neuropsychologists work in hospitals, in universities. There's medical universities, there's academic, more academically focused universities. Many individuals go on to have a private practice. Many work as researchers in pharmaceutical companies or in biotechnologies nowadays, an evolving area. So if you look at these three boxes, you can think about mixing and matching across these three boxes as opportunities for looking for jobs out in the real world as a neuropsychologist. Next. So to give you a little bit of an example of what kind of role or what a career in neuropsychology might look like, I'll use myself as an example. I am currently a tenured professor of psychology, and that's what I was trained in, obviously. But I also have a point in biomedical engineering. And part of this comes because of the research that I do, but also because I contribute to the development of new technologies that have medical applications for the neurological populations that I work with. So there's a real nice way to kind of tie all of this together, especially through my researcher. I am the department head of psychology, and I also direct the Applied Neurotechnology Lab at Drexel. So there are opportunities for neuropsychologists to do administrative leadership roles. I'm also the president of the Association of Doctoral Education of Clinical Neuropsychologists. And so not only am I kind of developing skills or roles within my university, but neuropsychologists can play a major role at a national level and really inform the training and development of future neuropsychologists. And obviously, at the end of the day, I do view myself as a clinical neuropsychologist because most of my research and most of my clinical work has been done with neurological populations. Next. So how did I get here? And we're going to touch on this because we are going to talk about kind of the proposed timeline or process for starting your career as a neuropsychologist. But first, I'll start first at the undergraduate level. At the undergraduate level, I was actually a biology major. And my initial thought was that I would move on to medical school, and my area of interest was neurology. However, by my fourth year in undergraduate school, what I did is I actually shadowed a neurologist and realized very quickly that I felt that being a physician would limit the interest that I had in working more closely with patients. So after my undergrad, I said, well, maybe I want to follow more strict science. And I went on and I got a master's at Temple University in neuroscience because that one aspect that I always enjoyed. So I spent 2 years at Temple studying the visual system of cockroaches, not exactly my specialty. So again, I started looking and trying to define what would be my interest. And during my second year in my master's training, I met a clinical neuropsychologist who introduced me to the field, who helped me identify appropriate schools, and who eventually directed me to graduate training in clinical neuropsychology. And so my clinical graduate training was with a clinical focus in rehabilitation. I did an internship at Mount Sinai in the rehabilitation department in New York City. I did my postdoctoral work. I actually focused in on research because up until that point I had done very little research from a neuropsych perspective. I had focused on clinical work. And so during my postdoc training, I learned how to write grants. And I was fortunate enough to get funding for a couple of big grants that then helped direct my early career at Kessler as a research faculty member, where I directed the virtual reality laboratory. However, after a few years, I missed doing other aspects such as teaching, and so I moved to Drexel in 2005, where I started as a research associate professor and have been there since then, teaching, mentoring, doing research, and more recently picking up a little bit of clinical work. So I use myself as an example to share with those of you interested in this type of career kind of the diversity that this degree offers, the kind of the ebb and flow of different areas that you can work in with this type of degree. Next. Sorry, so this is where I am right now. I am a teacher and a mentor. I continue to do research, and I am more involved in administration at this point. Next. So let's start talking then about what is required for training as a neuropsychologist. And I anticipate that some of you might have questions here, so I'll try to be clear in terms of the path, the expected path. At the undergraduate level, this is the very beginning of training. As I stated before, at the undergraduate level, there is no set major that you necessarily have to have in order to go into neuropsychology. I have received students who have their undergrad degrees like in psychology, in neuroscience, in biology. So at the undergraduate level, you still have the opportunity to kind of follow those areas that are of great interest. Undergraduate is followed by graduate training, a PhD or a PsyD. Most programs are going to be 4 to 5 years of training. So I want to be clear on the commitment that you're making. Most programs, and I know we're going to talk about what to ask programs, it's really an important question, because an important question is always, how long on average do your students take to finish graduate training? And it's something to consider because it's the commitment that you're making. For example, at Drexel, the majority of our students finish in 4 years, and then they have their additional 1 year of internship. So basically, they're making a 4-year commitment to come and be in Philadelphia, and then internship, usually they're moving on to other places. But I know for a fact that many programs have more of a 5-year average plus the additional 1-year internship. Following your graduate training and your internship, you have your 2-year postdoctoral training right now, which is an expectation that is strongly recommended for neuropsychologists. And then following that, there are the long-term goals of licensure and maintaining your continued education, And then nowadays, board certification. This is really becoming an expectation for neuropsychologists, and I can tell you that many jobs now require board-certified neuropsychologists. So in plan for this kind of training, it's important to put that component into your timeline, you know, from the very beginning. Next. So at the undergraduate level, you can be a little bit more broader and have different backgrounds of, like I said, psychology, biology, or neuroscience. But once you start getting to the graduate level, it's important to recognize that your degree is not in neuropsychology. Your degree is a degree in psychology with a specialization in neuropsychology, depending on the program that you go to. And I make that clarification because sometimes students will say, well, I have my PhD in neuropsychology. Well, I can tell you that that doesn't exist. Drexel, many years ago, was one of the only programs that actually offered a PhD in neuropsychology. But in order to be an APA-accredited program, you actually cannot offer a degree in neuropsychology. You offer a degree in psychology with a specialization or focus in neuropsych. Now, so that's one important consideration for training. The other important consideration for training is that as you go through your training or as you inquire about programs, you will hear the term Houston guidelines thrown around. And just to provide a little bit of background, the Houston guidelines are, I guess the best definition are foundational guidelines or recommendations for training. And they're guidelines that were generated back in '98 in a consensus meeting by leading neuropsychologists of the field in the time. The meeting was held in Houston, and these guidelines were generated. Now, the challenge with the Houston guidelines are that if you read through them verbatim, their primary focus is on postdoctoral training. But the reality of training in neuropsychology is that most students will begin to focus their training at the graduate level. And so for undergrads considering or thinking about going into neuropsychology, it's important to ask the types of questions that will expose you to that very early on at your graduate training. So this is, again, somewhat of a difference between what we put in the guidelines and how things really work. And then finally, the final psychological training consideration for those of you thinking of this area to consider is APA accreditation. So I know that we're going to touch on this a little bit later, but it is important to understand that APA accredits, or in other words, approves of programs at the graduate level and at the internship level. And so part of the question for the graduate level in particular is to understand whether a program is APA accredited or not, and if it is, whether it has neuropsychology as a major area of study, an emphasis, an experience, or an exposure. This is a very important distinction for undergrads to understand, because programs who list their experience as exposure are really kind of at the minimum requirements for exposing students to neuropsychological training. The other end of the spectrum is the major area of study. Programs that list themselves as having a major area of study are those that are that include higher requirements and expectations in neuropsychological training at the graduate level. So this is an important distinction. Next, please. So let's focus in on how to make yourself competitive if you are thinking about applying to graduate training in neuropsychology. Next. So, as I mentioned before, the major that students come from can vary quite a bit. One thing to keep in mind is that what grad schools are looking for are experience within the life sciences, or many of them having a scientific background. Because neuropsychology is so focused on brain functioning and brain physiology, there often tends to be a higher expectation for science exposure, or I should say there's those students who have more exposure to sciences at the undergraduate level can have an advantage when applying to graduate schools. And if your major doesn't require those types of courses, there's nothing wrong with taking some courses that might be relevant to brain behavior relationships, or to using your electives to expose yourself to some of these courses, things like neuroanatomy, cognitive neuroscience, neurophysiology. Those are all courses that would be looked favorably by programs except graduate students. Now, you certainly should think about your courses, but you have to remember that GPA matters. You have to work hard to keep your GPA high. No matter what your major is, a strong undergraduate GPA will stand out. And it's important to understand that because of the large number of applications that most schools receive, it is not uncommon to use GPA as a cutoff criteria. So, for example, some schools might tell you point blank, if you don't have a GPA of 3.5 or better, your application isn't going to be reviewed. So GPA is something to work on and maintain throughout your undergraduate training. Next. So it's important also then to get hands dirty and to get into some neuropsychology experiences. You can have a wide variety of neuropsychology experiences. I honestly cannot say which one is the best one. All of them can be strengths. You can look for clinical neuropsych experiences where you might volunteer at a rehab hospital, or you might shadow a neuropsychologist. You can look for research exposure and become a research assistant in a neuropsychology lab or another lab doing brain behavior research. You should absolutely look for opportunities for scholarships or different types of experience. Those are always looked on very favorably. And these positions can be paid or unpaid. If you're in a situation where you have a paid position, looking for a psychiatrist position where you can learn how to administer neuropsychological tasks and work with neuropsychological populations can certainly strengthen your application. So these experiences are really important because they allow you to learn firsthand what a neuropsychologist does. What it offers is a better rationale or reasoning for why you are applying to this for this degree. It will help in not only your essay, but also in your interview, because you'll be speaking from experience, from having been exposed, as opposed to just speaking to, this sounds interesting to me. So I strongly recommend looking for opportunities for experiences. Next. Mentorship. This is another critical area of getting ready or making yourself competitive for the graduate programs. There are several student-led mentorship programs, and I know we'll be talking about some of them towards the end of the webinar. You should look for mentors from coursework or courses that you're taking. You can look for mentors in research labs that you're volunteering or clinical settings that you're volunteering. If you are an underrepresented minority group, I cannot emphasize the importance of mentorship enough. There is a growing number of underrepresented minority groups who need neuropsychological services, and we have a limited number of clinical neuropsychologists that come from ethnically diverse groups. And so finding the right mentor to help you navigate this process will be key to helping you start and get involved in the training. So the mentorship becomes really important because, again, it will help solidify your thinking and why you're going into this field. But more importantly, that these mentors are critical for writing letters of recommendation. Letters of recommendation are an important factor in the decision making for acceptance into graduate school. The better an individual knows you, the better the letter they can write. So going out and seeking mentorship, seeking experience can generate strong letters of recommendation. Next. And so this combination of getting experiences and getting a mentor really can make you stand out in the sense that, one, it allows you exposure to the field so that when you're answering the question, which many of you will get asked if you apply to graduate programs, why do you want to be a clinical neuropsychologist? Your answer will be a more thoughtful answer. It will express a more thoughtful decision for why you're applying to this program. And that will come across in your presentation, both interpersonally and in the writing. The other key thing is that neuropsychology is generally still a small field. Although sometimes it feels very big, there are many connections across neuropsychologists currently in the field. Honestly, everyone knows everyone. Or what's that saying? People are only separated by maybe 2 degrees, not 6 degrees. So by going out and getting experience and meeting a mentor, it positions you to getting to know individuals who might know other people in the field, who can provide a more focused letter of recommendation, or who can provide a word-of-mouth recommendation, which is very powerful, because I can share that if I see a student as trained with, let's say, somebody that I know or a past student of mine, then I know a little bit already about the experiences that student has had. And that gives that student a little bit of a leverage in that I'm not guessing what kind of experiences or what have they been trained in. I have a sense of what they've been trained in. So if they know your mentor, they know your training. If they know your mentor, they're likely to pick up the phone and ask questions. So really putting yourself out there and getting to know neuropsychologists is an important component. Next. So then the other big area is your essay. So your essay, the challenge of generating a strong essay is that you have to give it depth. If I had to describe what's the difference between a very good essay, personal essay, and a not so great one, it's going to be the depth within that essay. That ability of that essay giving me a sense of who the individual is personally, and why they are a match to my specific program. So one of the things, how you add that depth, is that if you have more experiences, then you can speak more specifically in your essay about how you got to the point where you're applying. It allows you to provide a clear rationale, a clear pathway of how you got here, and importantly, where you want to go. Okay? A strong essay also has specifics about the program that you are applying to, or maybe not, because because the application process has changed so much. You don't do necessarily individualized letters, but wherever possible, you really want to tie that into the program that you are applying. And why this is important is because what programs are looking for is a match. If you are me, if you have a strong GPA, if you have a strong GRE, if you have a strong kind of CV with presentations or authorships, you're already doing well. And what's going to make you different from others is how well you match to that program. So getting that match across in your essay is an important component. Next. So again, building your CV, the other piece of your application. This is where being involved in a research lab can really shine through, because it allows you, or you should create opportunities for doing poster presentations, being involved in papers, being involved in research. Poster presentations will give you exposure to neuropsychology conferences. Some of our main conferences, INS, APA, AACN, NAN. Students can volunteer at these conferences or attend and get a sense of what's happening in the field. So again, the more you put yourself out there, the more connected you are with the field, the easier it is to present yourself in your application. Next. So some key advice here. One of the things that I have seen in the past with many students is that they often don't take the time to prepare. So giving yourself a timeline and starting early is an important first step. You should be planning on your GREs. As I said, the score is important and often used as a cutoff for many places. So many people, it is not uncommon for the majority of people to have taken GREs at least 2 times. Some schools, but not many, look at psych GREs. So again, it's important to do your homework and look at the program that you're interested in and find out whether they are going to be looking at the psych GRE score, because that does vary significantly. Start early so that you're seeking experiences during your undergraduate years. The sooner you start, the better. So even if you're only in your second year and you're not quite sure whether neuropsychology is the route you want to take, it's better to create an opportunity where you go, immerse yourself in neuropsychology and check it out and see if you like it or not. That gives you an opportunity to either start the path for getting your first ready and being involved, or if you don't like it, then you can move on to something that might be more of your interest. The challenge is that I see too many applicants who wait till their senior year to actually start getting involved or exposed to neuropsychology. And oftentimes by senior year and starting things at senior year, it's a lot more challenging. It's a lot harder to build up your CV and to build up all those pieces in such a short time frame. So starting as early as your second year in undergrad is highly recommended. Next. So to kind of put all these pieces together, what is a strong application? And again, I will do this from the perspective of Drexel, which is, I think, consistent with many of the other doctoral programs, and I speak from some of the data that we've collected from ADECN on this. So a strong applicant starts off with a strong undergraduate GPA and a strong GRE scores. Those have to be at the high percentile. You want strong letters of recommendations. And by that I mean writers that can speak to specifics about you and your strengths. Writers who know you as an individual and who can comment to how you will take some of your strengths and apply them to being successful in your graduate training. Successful applicants have a strong CV. That means that their CV includes experiences in the field where they have either volunteered clinically or in research or attended conferences and been involved in conferences. A strong CV has at least a couple of presentations. Publications are a nice addition and nowadays almost an expectation. Many of the applicants that I get have at least one, if not two, publications where the applicant is a co-author, or it doesn't matter if you are, author number 6 in a lineup of 9. It doesn't matter. It's more about the experience of being part of a team that actually generates a publication. And many of the applicants show nowadays come in stating that they have received some kind of scholarship, some kind of research or award, and this is a big plus. And this is why starting early can be very helpful, because if you manage, and there are many opportunities out there that often go unapplied for because people don't know about them. If you can, even a small award, a small $100 award is going to look impressive because it shows that the individual took initiative, competed for something, and got something. So anything like that is definitely going to stand out. And then finally, a strong essay with some of the elements that I discussed earlier. Next. So in summary, what does this process look like? I would say in your second year, begin early. Talk to mentors. Look for neuropsychologists. Find out where is the nearest neuropsychologist around you. Is there one in your department? If there isn't, work through some of the student groups to find a nearby neuropsychologist mentor. Find out about local hospitals, in the rehab department, in the neurology department, in the psychiatry department. These are places where you find a neuropsychologist. And then apply, volunteer, get involved in neuropsychological activities. Your third year is when you should really start getting involved in research. Research where you actively contribute and can hopefully present a poster or have an opportunity for writing. In the third year, you should also start planning for the GREs. Next. You should begin by identifying potential programs so that you assess what the expectations are going to be or for the requirements are. And importantly, so you can set up deadlines for this application so that you have a sense of the timeline of when things will be due. Many programs are usually due around early December. I know our applications are due on December 1st. So having a good timeline and a good sense of when things are due will allow you to not have a rush approach to this process. At the end of the third year, the summer after your third year, this is really the time when you should start concentrating on your essay. And the more time you give yourself for this, the more time you give yourself to have others read it, edit, provide input, the better that essay is going to be. And so in your fourth year, you're obviously finalizing everything, finalizing your application. And so this is when you are getting everything out and then wrapping things up. There's really, the majority of this should be started in the third year, because by the fourth year, your applications are going to be due, and so you're going to be spending a lot of time preparing those applications. So next. So in closing, the last thing that I'm going to leave you with is that it is not uncommon to not be accepted the first time that you apply. It is an extremely competitive process. I can tell you that at Drexel, we get anywhere from 600 to 700 applications for 10 slots, of which only 2 or 3 are neuropsychology slots. So the numbers really speak for themselves. So don't be dismayed if you don't get in the first time. What you move to is, what do I do then? Because now I have a year before I can apply again. How do I make the decision of how do I fill that time? Many individuals will have to work. So if you have to work, then I would encourage you to consider a neuropsychology related position. As I said, perhaps as a psychometrist or some other type of neuropsych related job. If you are in a position where you can volunteer, and then I would definitely add that. You can also volunteer at rehab hospitals or clinical hospitals that allow you to be exposed to some of the neuropsychological populations that you might want to work with down the line. Many of you will consider master's programs, and there's certainly, these can be beneficial. These tend to be most beneficial when perhaps your GPA or your GRE might be a little bit more borderline. Master's programs can help demonstrate that you have the ability to handle graduate level coursework. So oftentimes you feel that you need to prove that you can get your GPA up or that you can handle graduate level courses. Master's programs are very good for this. In addition, master's programs are very good for building up your CV, because many programs will allow opportunities for students to become involved and for students to have in research and presentations and then publications. So set your timeline for applying again and set a game plan for applying again. And don't get discouraged if the first time you don't succeed. Next. So I believe that that is the end of my segment, and I guess I'm going to turn it over now to Octavio to see if we have questions that have come up.
Yes, we have a few questions. One of them is, for example, what is the average of applications that are typically submitted, or that people should consider when applying for grad school, given how competitive it is?
That is a good question. I don't want to say that there's a magic number, but I think that in many cases, most students are applying to somewhere like around 12. About 12 programs is, if I had to pick a mean, there are somewhere around there, 12, 13 programs. And the reason I say this is because if you think about how many neuropsychology programs are actually out there, nationally there's only about 40 graduate training programs that have some element of neuropsychology. So most people are going to limit that to their top choices, to where they match, and there might be geographical reasons why individuals might not go to certain places. So I think on average, most people are like somewhere around 12, maybe an extreme might be 15 or so, but that's the number that people tend to hover around.
Some people sometimes are concerned about the type of experience that they are getting. Let's say that they couldn't secure a neuropsych experience, but they are doing neuroscience work, but they would like basically to pursue neuropsychology as a career. You know, some people wonder about how to go about, you know, presenting themselves, and if they would be competitive compared to other applicants.
So I think that my point of thinking through building yourself up as how your experiences are going to relate to becoming a clinical neuropsychologist is really important. So let's say you're a neuroscience major and you're in a neuroscience program and you really enjoy this kind of work, but you want to apply it clinically and you want to be applying to clinical programs. So while you'll have a solid foundation in research and in neuroscience, you might want to look for experiences where you can volunteer in clinical settings. You might want to volunteer at a rehab hospital or in different clinical settings where you're going to be exposed to the clinical populations that you would be working with. And so you're complementing kind of your academic scientific training with kind of clinical hands-on experience with the populations that you would want to work with.
Thank you, Dr. Schultz. I think that James has a few questions.
Thank you, Octavio. I have a question here. What is the perspective on the undergraduate research field that does not directly relate to the research lab of the graduate program that I am applying for?
So, what is perspective of? If I'm understanding it correctly, the question refers to if you're a student and you're applying to a lab and your research interest isn't directly related to the lab that you're applying to? Am I interpreting?
I think that's along the lines, yes. So what's the perspective on that?
Okay. So I think the thing to consider here, excuse me, is that programs are going to be, if you're a strong candidate, programs are, the differential is going to be the match. And whether it's not just whether you match to the program on interest of neuropsychology, but whether the program can offer you the training that you want. So I'll give you an example. My area of neuropsychology is in neurology, neurological medicine, and rehabilitation medicine. I have very little exposure in psychiatry. So if an applicant said to me, I really, really want to do work in schizophrenia, I might be hesitant to bring that individual in comparison to, let's say, an individual who is applying and wants to work with traumatic brain injury. And it's not because anything about that individual, but for me, it's the decision of what can I offer that individual. I have less to offer from a training perspective, somebody who really wants to do, let's say, schizophrenia research, than compared to a student who wants to do rehabilitation in TBI. I have much more to offer them. So this is what I mean when I say about the match. In that sense, the match would be stronger for the student that's interested in rehab than the student that's interested in schizophrenia. So what that means is that it's really on the student to do the homework and try and get a sense of what is actually going on in the lab that they are applying to. And it's important to remember that most labs have multiple lines of studies, not just one area. Maybe they're known for one area, but they typically have multiple projects going on. So it's important for the student to educate themselves about that.
James,
All right.
do you have any other questions?
I have another question. What is a good GRE score range I should aim for as I apply to clinical neuropsychology programs?
You know, I thought somebody was going to ask me that question. And I don't have those numbers in front of me, but here's what I can offer, and I think you guys are going to touch on this a little bit later. All APA accredited programs have to report on their website the GPA and GRE of their accepted class each year. So if you want to get a sense of what's the average GPA and GRE for a program that you're interested in, go to that webpage. The APA requires that all accredited programs have a summary of this, and it's made publicly available. So if you want to know where your GRE should be, look specifically at that page for the programs that you're looking at.
We have another question. Do I need to have a letter of recommendation from a board-certified neuropsychologist for my applications?
No. There's no specific criteria for who writes your letter of recommendation, but a strong letter of recommendation from a neuropsychologist who knows you, who has experience with you, would be much more valuable than a okay letter from somebody who's board certified. It's the content of the letter that matters a lot. If you happen to be working with a neuropsychologist that's well known or is established in the field, then it is completely acceptable for a student to ask, you know, would that person be willing to reach out to programs or put in a good word, if you will, for that person. But there's no specific requirement for letter of recommendation.
Do neuropsychologists do more therapy or assessment? That's another question.
Sure. Long ago, neuropsychologists did a lot more assessment. Nowadays, it depends on the setting that you're at and what's expected of the neuropsychologist. So there might be some psychiatric departments where the assessment of dementia, which is a behavioral diagnosis made by neuropsychologists, is the primary responsibility of the individual, of the neuropsychologist in that department. So that neuropsychologist might be focused on assessment more than anything. But many neuropsychologists and many jobs now don't focus on assessment. They're looking for intervention. They're looking for neuropsychologists who know the field of cognitive rehabilitation and can apply some of that. And they're looking for input from the neuropsychologists, especially with a lot of the multidisciplinary models that hospitals and medical settings are moving to.
Thank you very much, Dr. Schultheis. Those were all the questions that we got. We really appreciate your participation and presentation in this webinar. We know that you have to leave now, so thank you so much again. And we will continue the presentations. I'm very happy to introduce our next speaker, Dr. Eddie Amin. Dr. Amin serves as the director of the brand new Office on Early Career Psychologists at the American Psychological Association. From November 2011 to May 2016, he was assistant director of the American Psychological Association of Graduate Students, APAGS. He graduated from Northwestern University with a bachelor's degree in psychology, Boston College with a master's in mental health counseling, and the University of Miami with a PhD in counseling psychology. Outside of his work at APA, he spends time serving on boards and advisory groups related to homeless youth and LGBT youth, and conducts psychological assessments for young asylum seekers to the U.S., as well as for adults on probation in Maryland. With you, Dr. Eddie Amin.
Thank you so much, Octavio, and hello to everybody. Thank you for joining this webinar. I will say, if there's any problem with my sound, I encourage Octavio or any of the presenters to just chime in and let me know to adjust some settings here.
Okay. No, it's very clear.
Okay, thanks. So I'm going to give you a little bit of an overview on financial literacy topics. I'll cover 3 things in the next 15 minutes, and I will be available at the end of the webinar to answer any questions that you might have. So please feel free to type them as we go along. I hope to cover some salary and debt information, tips on managing and repaying debt, and as well as cover some information about loan repayment programs for those of you that are forward-thinking and want to know how you might deal with some of the debt that I tell you you are likely to accrue. Next slide. Thanks. And so I'm starting with, this is my happy place. This is an ocean, and I am giving you at least my imagery. If this is not your happy place, then please substitute your own calm, cool place here, because sometimes debt, just discussing debt, is a little anxiety-provoking. And I want to just remind you to breathe, to know that it's still anticipatory debt, and there are a lot of strategies to mitigate it and to deal with it, even if you have accrued a lot at the end of your graduate career. So, happy place. Next slide. I participated as one of the authors in a debt study that was published in Training and Education and Professional Psychology, or TEP, this year. And our study looked at how much debt you are likely to accrue based on 3 different kinds of degrees. Now, the first 2 are the ones that are going to be most relevant to you if you're pursuing a degree in clinical neuropsych, and the last one is SRO, which stands for Science, Research, and Other Fields, just so that you have a comparison. If you are a student that wants to do cognitive or social or experimental, you'd be looking at the last column for SRO. Now, going back to the first 2 columns, HSP stands for Health Service Provider or Health Service Psychology, and you would fall in this category if you were studying a degree that would allow you to eventually become licensed as a psychologist. So I'm comparing the likelihood of student loans, of taking out any student loans at all, for students in these 3 degrees. So if you got a PhD and you wanted to do clinical neuropsych, there's a 77% chance that you will take out some student loans. 91% if you got a PsyD, and 63% if you wanted to get another type of doctorate in psychology. Next slide, please. This looks at the median debt by degree type. So I'm continuing those same 3 categories here, and looking at what is the 50th percentile of those who have graduate student debt. Now, this is a survey. This information comes from early career psychologists in the 2013 and 2014 graduating cohorts. So the median debt, the 50th percentile, for folks that were going on to get a license in psychology eventually, at the PhD, was $75,000. It was $200,000 for folks that got a PsyD, and for all other students, just for comparison's sake, it was $45,000. You can see that not all debt is created equal, and you may be likely to carry more debt based on the type of degree that you end up pursuing. Next slide, please. Okay, and this is specific to neuropsychology students. This is a survey conducted by Whitehall and colleagues. It was published in this year's Clinical Neuropsychologist. I highly recommend that you look for this article, because not only is there debt information here, but a lot more great information from a survey of 300 plus neuropsych trainees. So this looks at expected debt totals at the graduate level for clinical neuropsych students that got a PhD versus a PsyD. And it's important to note that the authors found a bimodal distribution. So pulling all debt data together, irrespective of what kind of degree, there were two kind of peaks. 32.7% of the trainee sample had minimal debt, which I think is characterized as below $25,000. And 45%, the second peak, had debt greater than $100,000. Now, if you go back to the pie charts here, we're looking at, in the first pie chart, nope, same slide. Yep. If you look at the first pie chart, and you start at the 12 o'clock and you go down to about 4 o'clock, you can see that 41% of trainees who are getting a PhD expect to graduate with less than $25,000. If we look for that same debt amount at the PsyD level, you'll see that 10% of students expect to graduate with less than $10,000. And there are broad reasons why this might be true. Generally, PhD programs are able to afford more assistantships and tuition reimbursements because their faculty are often recipients of large grants that can then float student tuition and other costs. So this is specific to clinical neuropsych, and I think that this is a great additional resource beyond the APAGS debt data that we collected. Next slide, please. Okay. This is just to give you a small tutorial on how much you would be paying back based on borrowing at the median level. So if you borrowed $104,000, I'm sorry, let me back up. If you borrowed the median amount for a PhD student that was going on to get a doctorate in clinical counseling or school psychology, that $75,000 after the current interest rate would be about $104,000. And your monthly payments would be $863 if you decided to pay that back over a 10-year period at standard repayment, or it would be $521 if you took the longest amount of time the government allows you to pay it back, which is 25 years. For folks getting a PsyD, if you borrowed $200,000, you would owe $276K after 10 years, and your monthly payments would be a bit higher, $2,300 for the 10-year standard repayment plan, and 25 years for the, $1,388 for the 25-year repayment plan. One caveat here, and I feel like inserting it here might be just as good of a place as any, is that a lot of students borrow federal loan money until they reach a cap, and I think the cap is around $163,000, after which they turn to private loans. International students, if any of our students online are international, would not typically be eligible for federal student loans and may need to rely on the private sector for borrowing. Generally, the federal government, we advise taking out federal loans over private just because there are greater protections, but we know that there are some restrictions based on citizenship status that make that an impossibility. Next slide, please. This looks at, from the same study that I did with Doran and colleagues, this looks at first-year starting salaries based on the type of degree and the type of subfield. So if we go right down to clinical neuropsychology, the minimum starting salary on your first year out would be $36,000, and the maximum $125,000. At the median amount, $72,500 would be about what 50% of clinical neuropsych first-year psychologists are making. You can see actually within that middle section for the health service provider subfields that clinical neuropsych salaries are generally higher than others. So you are choosing a career that not only provides a lot of good to society and to your patients, but also one that is more handsomely compensated on average than some of the other health service fields. Thank you. Next slide. Our previous presenter told you that accredited programs have to provide certain information on their program home pages. The good news for my part of the talk is that they also have to provide information on tuition costs. So any APA accredited program will have a link on their home page, and the link has to say the following: student outcomes, admissions, and other data. So this makes it really easy to compare across programs because you can click that link on any number of accredited doctoral program pages. And APA sort of mandates what the information has to look like. Now, schools can provide additional information, and they can provide footnotes to these charts, but the chart that I think is really interesting to this part of the talk is the one that concerns tuition. So you'll get information on tuition for full-timers, in-state and out-of-state. If the school allows you to do part-time work, it'll tell you what the tuition per credit hour is. It'll provide information on university and institutional fees, and as well as estimated fees and costs to students beyond the above, so books, travel, and etc. What I encourage you to do is to consider your cost of living relative to the amount that you're used to paying now. Now, for some of you, that might mean moving into the private housing market, perhaps needing a car if you're moving to a place that doesn't have great public transportation, perhaps living on your own for the first time, as well as absorbing other costs that might have to do with family expenses. And we ask you to think, when you think of your budget, of these other factors like housing, food, transport, childcare. Some schools may require you to purchase or rent testing kits. You may have some lab fees, although I don't know how common that actually is. Health insurance is not included in the amounts above. Some schools may provide it, but again, you'll want to find that out. You may have to carry liability insurance if you're doing practicum or externship. You may be required in some schools to do personal psychotherapy, and that cost may or may not be included in your insurance or picked up by the school. And you may have membership fees in associations, such as those associations represented on tonight's webinar. So needless to say, the school will provide some information that will help you. You might see, for example, that the tuition for full-time students, if you're lucky, will say 0, and that means that the school provides a tuition reimbursement. Usually that's in exchange for working for a professor, and I'll explain that a little bit more on the next page. So these are some of the questions I think that you will be well prepared to ask after today, and I strongly encourage you to ask these questions because the information here will help you get a full picture, not only of the strength of the program and how good of a fit it will be for you, but also what you might anticipate the spending each year and how much in total you'll owe back after you graduate. So some good questions to ask, which are generally not included in public information, is how many students in the first year are funded? And then a follow-up question, is funding guaranteed each year? I think my university at the time I attended provided tuition reimbursement, so 0 tuition costs to students for the first 4 years. And if you spent more time on campus before internship, then you're expected to pay your tuition out of your own pocket. Question 3 is, how much are students typically funded and how? So in other words, do you get a tuition waiver? Are there any scholarships that are available or a fellowship? Usually those are things that you don't have to pay back at all. Or will you get a stipend in exchange for working? I know that at my university, different labs had different stipend amounts, but in general they hovered around $21,000 to $22,000 when I graduated 4 years ago. So you'll want to do your homework and find out what the funding situation looks like, and that might vary by professor. How do you determine who gets what assistantships or fellowships? In other words, is there an application process? Does everybody get it? Will I have to make some type of milestone in my first year to be guaranteed that funding in year 2? And then lastly, how much debt do graduates have? And are their loans generally private or federal? I think the first 4 questions can be answered by faculty or by staff in a graduate program, but the last question may or may not be answered by faculty. I think sometimes you'll get the best on-the-ground information by asking current students or recent alums. And one thing you can do with a program that you're looking at is say, do you have any current students or alums that I can speak with? They'll be able to tell you more clearly about the picture of debt because they're the ones borrowing. Next slide, please. This is a picture of total student loan debt upon graduation. We had this at a recent APA convention, and we asked people to just walk up and put a sticker indicating how much debt they'll have. So you can see that there's a pretty decent spread. We did this again more recently, I think last year at another APA convention, and we realized that because there were a number of stickers that pushed over the edge, the right edge of the chart, beyond $200,000, that we decided to go up to $250,000, and we found still a high number of students taking out a lot of loan debt. But I've already given you some stats on what your likelihood of taking out loans is going to be. Importantly now, let's look at how you plan to deal with your student loan debt, because just because you accumulate it, it doesn't mean that you're going to be stuck with it for life or that you won't be able to thrive in your career. Now, we typically don't make as much as med students or medical doctors, I should say, but there are ways to repay. So we asked people, how many of you are likely to practice denial? It's not just a river in Egypt. And you can see in that first lower box, a number of people said, yeah, I'm denying my debt. It's not there yet. I don't have payments. I'm not too worried about it. Some suggested that they were going to be paying it down slowly by starting now, cutting down on their borrowing, for example, recognizing that a latte that costs $3 now may cost $5 after you enter 10 or more years of repayment. Some people said they plan to pay it off slowly by taking a longer payoff period, lowering their payments to a manageable amount. Some thought the exact opposite, by paying it off really quickly, taking out perhaps a second job and making higher payments. And then a number of people, the highest number, said that they plan to pay it off creatively by a loan repayment or forgiveness program. And I want to highlight a couple of those, if I may. Thanks, Octavio. The two that I want to highlight for you are the ones that are going to be most common to folks in your boat once you graduate. The first is the National Health Service Corps. They have a loan repayment that will give up to $50,000 in loan repayment in exchange for 2 full-time years doing clinical work in an underserved area. This is a competitive loan payment program with only a modest federal budget. So you have to apply, you have to demonstrate that the site in which you're working is a underserved area, and the federal government has a formula to determine what that is and whether your site would meet the qualifications. And then once you're enrolled in the program, they'll give you a check for $50,000 up front. If you don't complete your service, then there might be ramifications about paying the federal government back. But this allows you to clear out a huge chunk of debt from the beginning. And in many cases, you can renew that 2-year commitment for another 1 or 2 years to pay off even more debt. That's a way to do it fast and to serve areas of greatest need. Sometimes whole cities are determined underserved areas by the federal government. And sometimes it's just a clinic or a certain neighborhood in a city. So you'll want to look at the National Health Service Corps website for more information. So that's a competitive program. A non-competitive program is the Public Service Loan Forgiveness Program. This is something that Congress instituted in 2007. And it tells me that if I pay off, if I work for a public service entity and I make minimum payments, or really any payments for that matter, consecutively for 10 years, that anything that I have left over in federal loans will be absolved by the government. The government will wipe out the rest of my federal loan debt. The great thing about this is there's a huge diversity in the definition of public service. So I work at APA, and that's considered a 501c3 organization, or better known as a nonprofit organization. There are many state and federal government offices and agencies, as well as academic positions that would also qualify. And you don't need to apply in the beginning, but you do need to express your intent to participate in this program. And what your loan servicer will do is help you figure out the best payment plan to maximize public service loan forgiveness. Now, in my case, I'm in this program, and 3 years into this program, I decided to make my monthly payments as low as possible. That way, when it comes time to show the government that I've worked for 10 years in a nonprofit, I'll be able to get the most debt repaid. And I also want to add that you have to make 120 payments while working in a qualified public service employment setting. Again, you have to make 120 payments in a qualified public service setting. That doesn't mean that you're automatically voided if you lose your job or take a year off and go abroad or work in a different kind of setting, but you just have to show that you have 120 payments working full-time in one or more public service settings. So I encourage you to just Google that phrase, Public Service Loan Forgiveness Program, and you'll get some more information about that. Those are the two most common ones, but if you go to the APA website, you can pull up our toolkit, the Affording and Repaying Graduate School Toolkit, and get more examples of loan repayment and forgiveness programs. So that's at apa.org/apags/resources. Next slide, please. Here are some helpful tips for getting funding. If you are interested in getting any of these loan repayment or forgiveness programs, I know I'm speaking way into the future now, but just a couple of good strategies to keep in mind is to save all your loan paperwork. You may have to sign, once you start graduate school, promissory notes. Once you graduate, you may consolidate. Save all of that information in a handy place and back it up. Keep up with your payments or deferments, because it's harder to get these programs and get your money back from the government if you go into default. The National Health Service Corps, for example, has a firm deadline, and you should pay attention to that website, sign up for updates so you don't miss the deadline to apply. Always review the application process in advance so you can get as much done as possible and be as prepared as possible to take advantage of the benefits of those programs. Give yourself time to apply, and also consider the ramifications of consolidating your loans with your partner or consolidating your student loans with non-educational loans, because that can make it harder or impossible to get repayment. Next slide, please. We're back to the happy place, and I intentionally put this in because I know that budgeting, finances, and related topics can be stressful. So I encourage you to breathe again. I'm going to try to do the same thing myself. And let's look at budgeting on the next slide. Here I'm just going to provide a couple of quick tips to get you to think about your budgeting practices. Now, you may be someone who keeps scrupulous track of how much you're spending, or you may be somebody who is more likely to say yes to a vacation and figure out how you'll pay it later. I think psychology has a great diversity in its trainees in terms of their financial practices, and this is not to call anyone out, but just to try to get us all on the same page. Tip number one is to know what you owe and face your federal loan debt. Even right now, if you're borrowing money from the federal government as an undergrad or as a recent grad, you can go to nslds.gov, log in with your FAFSA information, and figure out how much the government says that you owe. And it's good to check that regularly, just so you can have the bottom dollar amount and potentially raise any discrepancies if any happen to appear. Also, you can know what you owe by rounding up other forms of debt, such as your credit card statements. Tip number two is to know your habits. I highly encourage the development of a good practice by the time you start graduate school to have a budget. And in that Affording and Repaying Grad School Toolkit that I just mentioned, and I'll mention again at the very end, we have a couple of different budget helpers, and from a bunch of different sources, so you can find one that works for you. Track your money for a couple of months before you set a budget, and then compare what you thought you were going to spend versus what you actually spend. I think it's quite revealing to realize that those small expenses that we make weekly or monthly really can sometimes be more than we anticipated. So getting information, like any good behaviorist would say, getting good information and tracking is the first step to behavior change. And then tip 3, learn new habits. Can you outsmart yourself by being a better saver? Perhaps automatically moving money from a checking to a savings account before you even see it or have a chance to spend it can be a really good practice. Ask yourself, when do you want to be debt-free? And you can even start backwards and work out a plan that way. And I do encourage you to make sure that your budget has room for having fun and also having not so fun. So in other words, you might anticipate that you have an old car and you'll have to replace it, or you may not anticipate that you're going to need some reserves for a family birth or a reason to travel somewhere. A good budget should have that cushioning in there. Next slide. While in grad school, APAGS generally advises you to do what you can to minimize debt by trying to live frugally. So some things to ask are, can you have a roommate? I know when I went to grad school, my first thought was, I'm so excited to live on my own, it'll be my first chance to. But I do know that I incurred more expenses because I had to pay rent totally on my own, and I had to pay for my lights and my air conditioning and my cable and my internet all on my own. Can you bike? I know that I would save, I don't do this, but I would save $100 in public transportation fees here in DC if I bike to work. Can you skip the latte? Can you cook at home? Would it be a good idea to not take credit cards out with you when you go out and just kind of take out as much cash as you budgeted for the week at the beginning of the week? Another tip is to see what you can do to increase income. Some graduate students freelance, editing things, dog sitting, perhaps a very part-time job if your university doesn't prohibit it. You might find that there's a lucrative market for people with your credentials who can tutor or provide SAT test prep. So there are a lot of ideas to make money on a very relaxed schedule. And then if you have loan debt, I do encourage you to pay interest as it accumulates if you can. If you don't pay it, and your loan provider will give you the amount that is accumulating and a payoff date, if you don't pay that interest, it gets tacked onto your principal. And so then you end up paying interest on interest over the long run. You can look for repayment options before graduating. I gave you 2 examples already. There's more at studentaid.ed.gov. And I do want to say that not many people are taking advantage of these programs. For example, only 18% of eligible borrowers are on an income-based repayment plan, which says that they're attempting to pay off their debt very quickly, but I imagine many students that are doing so are eligible for these plans that would allow them to pay less over time and get the government to write off some of that debt. And then finally, be aware of private non-federal loans because they often don't have as many protections. Next slide. If you go to tinyurl.com/budget sheets, again, tinyurl.com/budget sheets, you'll see a couple of, actually a great number of different budget calculators that you can call up and use, play with, modify. One is a super basic budget. The other one is a debt reduction calculator where you can put in all your credit card balances and interest rates, and that Excel document will help you maximize payment so you're paying off as little interest as possible, and you can actually see an end in sight if you use that. Next slide, and I'm just about done. My second to last slide is just a reminder of that great set of tools at apa.org/apags/resources. You can watch a number of videos, for example, the costs of and paying for grad school. You can see the Affording and Repaying Grad School Toolkit. And one additional thing that you can see there is a previous webinar that I gave on the 15 factors to consider when you're evaluating graduate programs. I know that getting into grad school is a hustle, and you have to worry about being a great candidate, but I also want you to think about the importance of evaluating programs very carefully so that you're in the best program for you. On the last slide is my email address, eamin@apa.org. You can email APAGS directly at apags@apa.org, and there are some additional sites for you to take a look at if you're interested.
Thank you, Dr. Amin, for your presentation, and we look forward to having you back for the Q&A at the end.
Absolutely.
My presentation seeks to provide useful resources for underrepresented students and for students with an interest in diverse populations to get further knowledge, training, and/or mentorship to better prepare for grad school and beyond. When talking about underrepresented students, I'm referring to individuals defined in terms of one or more of the following: race, ethnicity, gender, age, disability, religion, sexual orientation, immigration status, first-generation college students, bilingualism and multilingualism, and individuals from financially disadvantaged backgrounds or circumstances. So to provide some context, in December of 1993, the APA resolution on ethnic minority recruitment and retention made psychologists aware that the US population was projected to change and become a pluralistic society. However, there is a current and projected underrepresentation of ethnic minority students, faculty, practitioners, and researchers in psychology. Such a lack of representation impacts the relevance of psychology to prepare students to function in a diversified society and to provide appropriate services. Therefore, the educational pipeline requires recruitment and retention efforts from pre-college to entry into the field of psychology. To resolve this big problem, APA places a high priority on issues related to the education of ethnic minorities, including planning appropriately diverse curricula, promoting psychology as a course of study and career option, as well as recruitment, retention, advising, and mentoring of minority students at all levels of training. Although there has been progress regarding recruitment of ethnic and racial minorities in psychology, these groups unfortunately continue to be well underrepresented in neuropsychology. Another important issue is that by 2050, it is estimated that 60% of the American population will not be testable with our largely monolingual, monocultural assessment toolkit due to the projected demographic shift in the US. In summary, doctoral faculty members and others involved in training and leadership need not only to be aware of these recruitment issues, but also to set a high priority on addressing them by encouraging, advising, and mentoring underrepresented undergraduates to join and diversify our field, so neuropsychological services can better respond to the increasing number of culturally and linguistically diverse people in the US. So to address some of these issues I just mentioned, the American Academy of Clinical Neuropsychology, AACN, launched the Relevance 2050 initiative, a very important call to action with the following objectives: aggressive recruitment of students and neuropsychologists from diverse linguistic, cultural, socioeconomic, religious, and other backgrounds into the field, into AACN and into AACN leadership. Develop training and supervision models as well as clinical strategies that members can access in order to begin to substantially increase the percentage of patients served competently. Support research and development of multilingual, multicultural assessment methods. And to achieve these goals, the Relevance 2050 is composed of several subcommittees, including the student pipeline, whose mission is to increase recruitment of diverse students and promote early education in board certification. Any of these subcommittees is open to everybody regardless of AACN membership. If you would like to get more information and join, please click on this link and contact Dr. Anita Sim. Okay, the Society for Clinical Neuropsychologists Ethnic and Minority Affairs Subcommittee mission is to promote the integration of diverse populations into the neuropsychological practice, research, teaching, and training. By doing so, IMA provides neuropsychologists and students with the knowledge and resources to better understand and serve increasingly diverse U.S. population while reducing the historic inequities present in our field. IMA currently has a mentorship program uniquely designed to provide time-limited advice about professional, work, or training-related issues for students and neuropsychologists of diverse backgrounds and with diverse interests. IMA also provides information and education on culturally relevant topics in neuropsychology via listserv, mentoring, and other events at the APA convention and at the International Neuropsychological Society's annual meeting, and via free webinars. To join the IMA listserv and to learn more about its mentoring program, please contact Dr. Michelle Medor. The Hispanic Neuropsychological Society focuses on promoting the competent practice of neuropsychology with Spanish-speaking populations and welcomes people with diverse interests and backgrounds. HNS offers networking events at neuropsychology conferences, provides professional consultation, and promotes collaboration regarding the use of testing instruments. The HNS Mentorship Committee offers student grants to recognize exceptional research, including Spanish-speaking individuals, a mentoring program, and manages a training database with graduate programs that offer specific training related to Hispanic neuropsychology. HNS also assists in the development of training programs, guidelines, and standards of practice for neuropsychological services to Hispanics in conjunction with other organizations. HNS has a new student organization. You can contact Dr. Joanna Rengifo for more information. The National Academy of Neuropsychology's Cultural and Diversity Committee's mission is to increase the knowledge of diversity issues and to promote the inclusion and affirmation of diversity. The committee offers conference diversity grand rounds at the annual NAN conference, covering a wide range of topics, from forensic cases to training issues. Also, 2 awards are offered at the conferences. The Diversity Abstract Award for the best student poster reflecting diversity-related topics or issues, and the Tony Wong Diversity Award recognizing a student's effort to promote public education, advocacy, and research in brain health in culturally diverse and minority communities. The Student Trainee Leadership and Mentoring Program offers advice on aspects of graduate school, applying for internship research and leadership opportunities, among others. And along with the Women in Leadership Committee, it sponsors professional development workshops and scholarships. The Culture and Diversity Committee also publishes a series of educational and guideline papers with other organizations available on their website, where you can also find a comprehensive list of minority health, use of interpreters, multiculturalism, and international resources. NAN has also a student committee to promote professional development that I encourage you to check out. Other resources you may consider are the INS International Liaison Committee, which promotes increased communication and collaboration among neuropsychologists worldwide and provides information on programs designed specifically for those from developing countries where resources and contact with other neuropsychologists may be limited. I have also included a link to the INS Student Liaison Committee that offers resources and discussion about international training in neuropsychology. Now I would like to introduce a fellow intern, James Garcia. James is a doctoral candidate in clinical health psychology at the University of North Texas. He's a second-generation Latino student and is the first in his family to complete high school, a bachelor's degree, a master's degree, and very soon a PhD. James is a behavioral medicine intern at the South Arizona Veteran Affairs Healthcare System. His clinical interests include working with Spanish-speaking Latinos who sustain traumatic brain injuries, stroke, and other medical issues. His research interests are in racial, ethnic, cardiovascular health disparities, with a focus on Latino cardiovascular health. James is the chair of the American Psychological Association of Graduate Students Committee for the Advancement of Racial and Ethnic Diversity, also known as APAGS-CARED.
Thank you so much, Octavio. So as a member of APAGS, I want to focus my presentation on providing tangible resources for most of you in attendance here as you navigate grad school applications in neuropsychology. My aim is to give tools to equip you, your toolkit, as you work on these applications. I will then focus on APAGS resources for students from diverse backgrounds. This is in line with my mission to promote the advancement of racial and ethnic diversity within psychology as chair of APAGS-CARED. But more importantly, the psychological associations are going to be the place where you as an undergraduate student can get help from experts in the field about navigating grad school applications. Next. Oh, sorry, stay. Sorry. So the first one, finding the right fit. The first link that I have on there is a presentation by Dr. Amin, Dr. El Gururi, and Dr. Fowler discussing the importance of finding a good fit. They talk or they touch upon the differences between a PhD, a PsyD, and a master's program. So for those folks that are thinking of alternative ways to get to clinical neuropsychology, you can check that out. The second one is Dr. William Norcross and Dr. Thomas Hagen discussing how to identify a program based on what we call C20 data. And this is the data that Dr. Amin highlighted in terms of student admissions, outcomes, and other data. The third is a tangible, user-friendly guide with examples on how to interpret the outcomes data, the C20 data, that APA-accredited programs are required to have. And I say APA-accredited because it's for most of these subspecialties, including clinical neuropsychology, it is easier to get a job if you graduate from an APA-accredited program. APA-accredited programs have oversight from the APA Commission on Accreditation, and they commit to providing high-quality training to students. This is in contrast to non-accredited programs who are not, these programs are not required to display data to applicants, nor are they required to provide high-quality training in some but not all instances. So I really highly encourage folks to focus on finding programs that are APA accredited. It makes licensure a lot easier, as well as board certification, including on clinical neuropsychology. Number 4 gives you a checklist you can use to inform, but not to solely inform, just to guide you in your determination if a doctoral program fits your needs. It's an APAGS resource. And number 5 gives you 12+ videos on how to prepare and apply for graduate school. And it covers topics such as constructing a timeline, taking necessary courses, research experiences, facing and conquering the GREs, understanding all the C20 data, and it ends in making a final decision. Next. I wanted to also touch a little bit on the writing, and this is, I think, the trickier part for most folks that are applying to graduate school broadly in clinical neuropsychology, more specific to this presentation. I included a link from PsyChi that gives you practical tips, literally a paragraph-by-paragraph breakdown for your personal statement. Now, it's going to have to be tailored to clinical neuropsychology, and this is where reaching out to the psychological associations like NUN or Hispanic Neuropsych Society, and finding a person that you can run the personal statement by, or even the person that's helping you write your letter of recommendation. You're going to have to tailor that personal statement for neuropsychology programs. The second link that I have on there is Dr. Nadine Kaslow talking about what you should highlight in your personal statement, some kind of do's and don'ts. Next. I can't stress enough, as an undergraduate student, join APA and APAGS as an undergraduate student affiliate member. Joining APA and APAGS makes you eligible for the APAGS PsyChi Junior Scientist Fellowship. So this is a $1,000 fellowship to support a research project in the first or second year. Applicants who apply to this program are provided with constructive feedback in order to strengthen their application for the very prestigious National Science Foundation NSF Graduate Research Fellowship. Not only that, but there are a couple of things in the works. I will tell you, through APAGS-CARED, we are in the process of creating an undergraduate mentoring program and fleshing out the details of that. So that would be something available to undergraduate student affiliates. Next. Now, in line with AACN's mission to diversify just the educational pipeline and also just our multicultural competence and assessment and in clinical work, as part of APAGS chair, I am kind of put in this position within APAGS to promote that, to advance racial and ethnic diversity. But I take a more diverse approach, not only race and ethnicity, but also sexual orientation, gender identity, disabilities, and other statuses seen and unseen. For those who identify as racial and ethnic minorities or who have a strong interest in working with racial and ethnic minorities in neuropsychology, Division 45, it's called the Psychological Study of Culture, Ethnicity, and Race. They have a mentoring program that undergrads can be a part of. I encourage you to check out their website and reach out to the student representative. The current student representative is Deza Daniels, and her email is listed on that website of Division 45. The second resource that I have here is the Division 44 website. They also have a mentoring program. Division 44 is a psychological study of lesbian, gay, bisexual, and transgender issues. They also have the mentoring program, and I also encourage undergrads to reach out to Skylar Jackson as a student representative, and I am blanking out on the second student rep, but there's another one as well. And their emails are also posted on that website. If you are a student of color, becoming aware of the ethnic minority psychological associations that are part of the American Psychological Association is important. Some of these, like the Asian American Psychological Association, have an undergraduate consortium where you go to present research, or you can go to learn about other faculties' research. And some of these folks might be in clinical neuropsychology, or can provide you with a link to someone who is in clinical neuropsychology and is interested in racial and ethnic diversity issues. The other resources that I provide are guides for undergraduate students. For example, a student with disabilities. You can find a guide on how to navigate some challenges through graduate training. So these are once you, let's say, or if you are thinking about applying to graduate school, what are some things that might come up if you are a person with a disability, and how are you going to manage that? Students of color, we also have through APAGS-CARED a resource guide for how to navigate grad school as a student of color. So if you're a student of color and you're thinking about grad school, that's something that I highly encourage you to read. If you're a student who identifies as LGBTQ+, the Committee for Lesbian, Gay, Bisexual, and Transgender Affairs, or it's called now Committee on Sexual Orientation and Gender Diversity, put out a LGBT climate guide on programs that are LGBT friendly, and some questions that you can ask these programs as you're interviewing to kind of get a sense of how LGBTQ friendly they are. And it's pretty useful. And lastly, the APA Office of Ethnic Minority Affairs. There's a career guide for students of color who are interested in just psychology, doctoral programs, and you can access this for free, and it's available there. I do want to make this information kind of known. Through APAGS-CARED, we're working on an international and undocumented student resource guide in collaboration with the National Latino Psych Association, and we expect to have that launched in sometime in fall 2016 for folks who identify as international students or as undocumented students. So that should be available as well. Next. All right.
Thank you, James, for your presentation. Now we will start our question and answer period. James will read aloud submitted questions and invite the speakers to answer them and provide comments on our suggestions when they consider appropriate. One of the questions that I got is actually for Dr. Amin and is related to like, is there a cap of debt that the students should keep in mind, you know, as they embark on grad school? Like, how much debt is too much debt, or what would it be recommended, you know, based on the literature or recommendations?
Yeah, that's a great question, and one that I think is probably one that I could ask 10 early career psychologists and I would get 10 different answers for. I would say that you want to make sure that you complete your schooling if you start a graduate program, and then you know, negotiate for a job that pays you what you think your worth is in terms of your skills and what you bring to an organization. I've shown you some salary information, and so you can see that you will probably live comfortably. There are very few psychologists at the early career level who identify as being underemployed, and there are even fewer who say that they had a tough time finding a job that matches their skill sets. So you'll have employment, and there's a good chance that you'll have relatively steady employment. And for each of you, it may have to do with other anticipated expenses, how much family contribution you might be able to rely on, what you hope to do when you're done. And unfortunately, I don't think that there is a really easy number, but I think that you can take a debt calculator, for example, and our APAGS website links to them, and then plug in some different numbers and get a sense of different loan payments per month. You can make an anticipatory budget and say, okay, well, it looks like, you know, if I'm paying the median amount, I'll make X amount of money, and I might have perhaps at the upper max I'm willing to take out this dollar amount in loans, and you can get a sense of what that payment would look like relative to the amount of money that you're taking in. Now, I'm not a financial advisor, so I don't want you to take this as financial advice, but one thing that I've heard from listening to folks give financial advice is that they often recommend paying no more than 10% of your monthly take-home income on debt-related expenses. That doesn't include your rent or your mortgage, but on debt that you owe your creditors. So student loan debt would factor into that. And you know, I know you're going to have a range of salaries, and you'll also have a range of debts when you're done. But if you can try to keep it to that small, manageable amount, that might therefore allow you to choose schools that are more in the price range or the expected debt range that you're comfortable with. There's great programs that do cost more than some programs that are virtually free, and ultimately it's a fit that needs to make sense for you.
Okay, I got another question. Thank you so much. What are the benefits to join, like, you know, psychological organizations or APA, APEX?
I think I can answer a little bit of that. So through APAGS, we are going to have a couple of initiatives, like the undergraduate mentoring program in the works. Division 45, which is one of the ethnic minority psychological associations within APA, has an established mentoring program. So as a student affiliate, you'd be able to take part in those opportunities. And it's important because some of the folks that sign up for those mentoring programs have been in clinical neuropsychology. And so they're open to mentoring a student, going through the application process, and even as a grad student from afar. We're not only to mention that, but also the resource guides that we have if you identify as an LGBTQ+ person, as a student of color, on navigating this whole process. There's a bunch of grants available as a grad student that you can apply to, especially if your research interests are diversity focused.
Thank you so much. Dr. Amin, would you like to say something about that?
I would say that there are a number of reasons why I think joining an association like APA would be worthwhile. Number one, it gives you that sense of professional community. You'll be able to clue yourself into things that are happening in the field, and new trends, new opportunities, new risks to psychology, opportunities to advocate on behalf of psychology and our publics, our societies that we care about, by being plugged in and being a part of this community. It can help shape your professional identity. You've got funding and savings at your fingertips, opportunities to network. You'll get a lot of things in the mail that you can read, that you can use to educate yourself beyond what you're learning in your classroom. So I'd say those are some of the reasons why our members stick around.
James, do we have any other questions?
Yes, I have a question here. How can students be involved in HNS, INS, and NAN? Undergraduate students, what opportunities are provided?
Yes, basically these are organizations where people basically join by paying dues. Students pay the lowest dues, so it's pretty easy basically to join. You just have to go to their websites. They typically have a form to fill out where you would select that you're an undergrad. There are several perks on top of what it has been told so far. So one of them is, for example, the ADECN offers free conference registration for ADECN student members. So that actually is a big saving if you plan to attend their conference. Also, volunteering at their conference will get you access to workshops that are usually, you have to pay for. So you would get them for free if you volunteer a few hours during the conference. And for example, the National Academy of Neuropsychology has a program where you can volunteer as well, and you will get not only free registration, but you also will get free hotel and an attendance to workshops that are also can be somewhat expensive. So those are some of the perks, but on top of that is basically you will develop your professional identity in neuropsychology. You will meet like-minded people, and specifically you can get a lot of mentorship, which is very important to be able to successfully navigate the application process, and once you're in, basically continue to build your network and become successful during your grad school as well. So those are some of the reasons. However, if you go to these websites, you will find all the opportunities that these organizations provide. I would suggest basically to kind of compare them and see which one you think may best fit your needs, and the one that offers the most benefits regarding your interests.
All right, thank you. That's my question that I had.
Okay. Any other questions?
No, I don't see any more questions coming in.
Okay, so thank you so much, James. I would like to thank our speakers for volunteering their time, as well as ADECN and APAGS-CARED for their tremendous support to make this webinar possible. I would also like to thank our attendees. We hope you found this information useful. Finally, this webinar will also be available on YouTube and on the ANST website. Thank you.